Dr. White, kind of the new thing, or I guess the procedure that baby boomers are doing now, they're getting away from doing the traditional facelift for a couple of reasons: cost and also recovery time. So what is this new hot procedure that you're seeing more and more of?
Basically, it is a lower facelift. Common term is a mini facelift. People have devised different ways to do it, so they give it their own name. We call our lower facelift by one of two names: a next day lift, or what's called a max lift. The direction of pull on the two is different. Next day lift is kind of a misnomer. The first person we did it on was our own patient care coordinator, who came back to work the next day. She's probably the only person in history that's come back to work the next day.
But how do you feel the next day?
Again, that varies from person to person. You've had a procedure. I think you're aware of it. It should not be painful. It's relatively minor.
So where are the incisions for a mini lift or next day lift?
The mini lift will vary depending on whether you're doing a next day lift. A next day lift incision goes in front of the ear. Often we put it behind this little piece of the ear, so it goes like that, behind the ear and in front of the hairline, or just behind the ear and higher up. The variation depends on the needs of the individual. The vector of pull sort of parallel to the jawline. The max lift is in the hairline, by the sideburn, again down in front of the ear and a little bit behind the ear. The vector of pull is more vertical. What I do is I sit someone in front of a mirror, show them what I would expect the results to be from a facelift, from what we're calling the next day lift and the max lift. And the patient can choose which of the three they think looks the best.
So what area does it correct mostly?
Mostly this area, the jowl and the neck, a little bit in the mid-face, but not much. If they want mid-face correction in addition, then a facelift does a better job of that.
So with this procedure, how many years younger will I look afterwards?
Well, that's in the
Will I look 18, 21?
That's in the eyes of the beholder, obviously. I tell people 5 to 10 years, but that's in the eyes of the beholder. One, it depends on how bad the problem is and how the condition of their skin. Some people it's very dramatic, and some people it's subtle, depending on the nature of the problem they have.
Since you've been doing facelifts for many of years and have some experience under your belt,
You're trying to say I'm older.
what do you see with patients that have a facelift, mini lift, next day lift, whatever, in their late 40s versus someone that waits until they're 68?
Someone who's 68 is going to get a much more dramatic change. They're more likely to want the facelift rather than the next day lift or the mini lift. Someone in their 40s is going to get a more subtle result. The question then gets to be, when do we do it? Should we do it in our mid-40s when we notice some changes we don't like? Or should we wait until we're 68 when we get the really dramatic change? My particular feeling about it, and I think most of my patients feel, as soon as the aging changes bother them, that's the time to do it. If you want the dramatic result, you have to live with things you don't like for 10 or 15 or 20 years to get the dramatic change.
So if I'm someone that decides to do it in my early 40s, late 40s, whichever, will I need to have it again when I'm 60?
That depends on the attitude. In the Midwest, our attitude is we want to look younger than our age. So if someone is, I'll use some example, 55, and they get one of these procedures and they look in the mirror and think they look 45, 10 years from now, they'll be 65. But if they look 45, that's okay. So in the Midwest, it's more unusual to repeat a facelift than, let's say, on the West Coast, where they like the really exaggerated look. And when they repeat the facelift frequently because they want you to know they've had a facelift. Midwest, we don't want you to know you've had a facelift.
Well, you brought up a good point, because I think so many people see all these different women and men that we can list that everyone would know in Hollywood that do look bizarre. So I think that's a lot of fear of women. They don't want to do that because they don't want that look. Can you have this procedure and not have those looks?
Oh yes, that's our goal is for you to look rested, for you to look refreshed, for no one to know that you've had a surgery, someone who doesn't know you well enough to know you had the surgery. So when you walk into a workplace or go to a social event, she looks good for her age. Not, boy, she had a facelift.
Gotcha. So getting back to this procedure, how long is it? Are you awake? Are you not? Do you go home that day? What's the procedure all about?
If all we do is a version of the Mini-Lift, there are two options. One option is to do it under local anesthesia in the office. They would get a Valium and a pain pill ahead of time, which just calms them down. They get local anesthetic, which numbs the area, and we can do the surgery. They can sleep, they can talk, they can listen to music, they can do what they want. I would say the surgery on average about 3 hours, depending on the condition of their tissues. The other option, and I'd say it's an option that maybe 20% of the people take, we can do it in a surgical facility with them asleep. That's more expensive. People like to do it in the office because they don't have to be asleep, or they like to do it in the office because they save money. If that's not an issue, then some do it at a surgical facility.
So is there a little more downtime or longer recovery when you go under general anesthesia?
I don't think so.
Okay. So speaking of recovery, how long? Obviously, you said it's not the next day. You just feel good you feel fine after surgery the next day. When would I want to be headed to the theater with a group of friends again?
It depends on attitude. I think someone who's anxious to get back to work, get out, do things, 4 days minimum. The next day lift offers the advantage over a facelift in that there's less bruising and swelling. But there's often at least some bruising. If your attitude is you don't care if anybody knows you had something done, you want to get into the swing of things, 4 days. If you want nobody to know you had anything done, depends on the amount of bruising, but probably at least a week. Most people, I think, probably take a week off of work. If you're the pretty face as the reception desk, you're going to wait longer than if you're, let's say, a hairdresser who having a little bit of bruising and swelling is a topic of conversation.
Okay. So obviously, since you said there's an incision, there's going to be sutures. When do you take those out?
We take the visible stitches out, the ones in this area at 4 days. All of the stitches are out by 3 weeks. The stitches that stay longer than 4 days are hidden by the hair, so that's not an issue.
Are those behind the ear?
They're behind the ear.
Okay. what should I expect after surgery? The night of, the next day? What will you have me do?
The night after surgery, I require that you spend with a responsible adult. You're going to do better if the head of your bed or contour chair is elevated. I think you're uncomfortable. You may or may not want to take pain pills. When we do this, we use long-acting local, so you're relatively comfortable. The next day, you can move around and do things that you want to do around the house. Most people don't want to be seen the next day, so they're not going to go out into public, but you certainly can. I think you're reasonably comfortable. Tylenol should handle any discomfort. When you're out in public really depends on your attitude. As I said, our patient care coordinator came to work an hour late the next day. But most people are certainly probably not going to want to be seen in public for 3-4 days.
So if you need to take the Tylenol, is it pain? Is it swelling? What is it that they feel that they need to take the Tylenol for?
Discomfort. I've not had it done, so I can't tell you how it feels. I would just describe it as discomfort. This is not a painful operation. We do painful operations. This is not one.
So will others notice that they've had surgery? Or what do patients tell you if they come back that people tell them?
They tell people compliment how nice they look. Some people don't want to tell anybody they've had surgery, so they get compliments and they say thank you.
What did they say? Your face looks tighter? You look like you've had surgery? What did they say?
You look really nice.
So they just notice an improvement, not a surgery.
Correct.
Good. So,
and there are obviously very, very observant people that notice that you had a jowl and looseness of skin of your neck 2 weeks ago and now that's gone.
Some things you can't hide.
I have friends where, a male friend as an example, where the women compliment him on how nice he looks. And he's open about the surgery, so they compliment him how nice the surgery went and how subtle it was.
So what do patients say to you, Dr. White, 3 months after they come in? What's their thoughts or feelings towards the next day lift?
Almost invariably, they really like it, and they like the fact that it's not that pulled, drastic look, and they think they look a lot better. And that's at the 6-month mark. Unless there are people having problems, we don't see them at 3 months. But at 6 months, they come in and talk about how really pleased they are. We like to give them their before and after pictures so they can see the difference.